exercise specialist, and today I'm supposed to talk to you guys about stretching. So, do any of you stretch on a regular basis? No? Good. Maybe you'll learn something today. Maybe you'll want to start. So our bodies are made up of bones and muscles and some other things, but we can't do much without our bones and muscles, right? Our bones keep our structure, and our muscles allow us to move and do everything that we want to do in our lives. Oh, that changed. Okay, so stretching is important. There's lots of things that it can do for us so that we can do all of those things that we want to do. It keeps our joints flexible so that we can do those things. I'll just hold this up. You guys can see it. So these are all the benefits that you're going to get from stretching all the time. Maintain and improve your flexibility and your range of motion. You're going to reduce your risk of injury and also your how sore you're going to be all the time. It helps you have better posture. It's going to improve your circulation because your muscles are flooded with nutrient-rich blood when you're stretching. It relieves stress. It helps you sleep better because it releases endorphins that makes you feel relaxed and loose, like if you stretch at night before you go to bed. It's going to enhance your physical fitness. And if you stretch after you exercise, it's going to help your body get rid of lactic acid that builds up in your muscles and makes you sore. And it's also going to help you not get dizzy after you exercise. So I'm just going to stick these over here after I talk about them if you guys want to look at them anymore. All right. So there are a lot of things that will affect our stretching and how flexible we are and how much we can do. I'm not a very flexible person. Some people can do the splits. So everyone is different. Some things that are going to affect how much you can stretch are just your joint structure or how your body is made, your age, also if you're male or female, the way that your connective tissue is put together, so just what's in your DNA, how much muscle mass you have, and then just how much you're used to stretching. You know, if you do it all the time, you can get a little bit more flexible. So there are a couple of different kinds of stretches. I'm here. The first one is ballistic, and the only reason I put that one on here is because it's not a good way to stretch. So this is when you're bouncing and you're forcing your joints kind of past their normal range of motion. It usually hurts, and you're damaging your tendons and your ligaments so that you actually have to get them better before you can get more flexible again. So don't do it that way. The next one is dynamic. Like it says on here, that's stretches that involves motion. So, for example, if you're just swinging a leg back and forth, it's moving the whole time, okay? You want to do those ones for 8 to 12 times when you're doing dynamic ones. Dynamic is a good way to stretch. The other good way to stretch is static. So these are ones that do not involve any motion, and this is just that you're putting your body into a position and holding it, and you want to hold it for 10 to 30 seconds. The last one on here is called passive stretching. This is also a good way to stretch. This is when you're using something else to help you stretch. So if you're using the wall, you know, to hold your arm in a certain position, or if you have somebody else helping you stretch, that would be passive stretching. You can use like the exercise bands or whatever. So those are kind of the ones. We'll practice some of these in a little while. All right. When you're stretching, it's really important to remember to breathe. Breathing is really important. It helps get oxygen into our blood, helps get the oxygen into our muscles. So proper breathing, you want to take slow, relaxed breaths while you're stretching. In through your mouth, hold it a little bit, and then out through either your nose or mouth. So let's practice one. Everyone take a nice deep breath. Hold it, and let it out nice and slow. Okay, so when you're stretching, when you're holding a stretch, that's when you want to be letting your breath out. So as you're going into the stretch, breathe in, and then hold it a little bit, and then let it out slow, and then relax your stretch. Okay? If you're stretching properly, then the day after you have stretched or done something, then you shouldn't be sore. So if you are sore, then maybe go just a little bit less than what you were doing. If you're stretching too much because you're wanting to get more flexible or whatever, like I said, if you overstretch something, you're going to hurt it, and then it has to get better before you can even get back to the part that you were at instead of getting further. Let's see. So one of the most important parts of stretching is to warm up first. Stretching is not warming up, it's part of warming up. So you never want to stretch cold muscles. You want to get them literally a little bit warm, and that means just moving them a little bit to warm up their temperature. When you warm up, it increases the blood flow to your muscles, and that increases the temperature, and it's going to help you not get hurt, and it will help you also achieve your optimal performance or get your greatest range of motion and your best stretches. So how to warm up is you just want to move your body, so 5 to 10 minutes. So if you've just been sitting for a while, get up and just move around. You don't have to do something too much. Just walk around the room, get your muscles moving. It should increase your heart rate just a little bit and increase your breathing a little bit if you're warming up properly. So after you're done warming up, then you can stretch. Stretching should take 5 to 10 minutes about, and each stretch, like I said, should last 10 to 30 seconds or 8 to 12 reps if they're moving stretches. Make sure that you're using all your muscles that you're going to be using in your activity that you're going to do. Like if you're stretching before you exercise. So if you're going for a walk or a run or something, then you'd want to stretch your lower back. You'd want to do your hamstrings and your quads and your calves, maybe your hips, your adductors, things like that. Make sure you're taking your joints through their full range of motion that you're going to be using for the activity. Like if you're doing something more aggressive like basketball, you may want to stretch just a little bit more. Make sure you're stretching slowly. If you do rapid movements, that tends to spasm your muscles or shorten them so that they won't be able to do as much instead of relaxing. So when you're stretching, that's normal to feel, you're going to feel a little discomfort, maybe even a little tingling. That's normal, but you don't want to feel pain. If there's a sharp pain, then you need to stop or relax. If you feel like saying ouch or a swear word, then it's too much. You don't want to do that. So let it go a little bit. So far everything we've talked about is stretching to get ready for an activity. So because this is what I do at the hospital, teach people about exercises, I want to kind of go over exercise a little bit. This is what the American Heart Association recommends for everyone to get for exercise. It's what we call the FIT principle. So each of these letters stand for something. The first F is for frequency. That's how often we should be exercising. And like it says on here, that's 4 to 6 days a week. We really do need to not exercise every day because our bodies really need at least 1 day a week to rebuild and reheal and recover from exercise. The I is for intensity. This is how hard we should be exercising. Like on here it says moderate. So we're not killing ourselves, but we need to do enough that we're doing something. Exercise is called a workout for a reason. It should be something harder than normal. It has to get your heart rate up, has to get you breathing harder, but we want it to be moderate. So on here it says the talk test. So that's just one way that you can decide how hard you're exercising. If you are too out of breath to carry on a conversation or talk to somebody next to you, then you're exercising too hard and you should slow down. If you can sing and hold a note, if you can hold a note anyway, everyone always says, well, I can't sing, it doesn't matter. So if you could then you're not working hard enough and you need to pick up the pace a little bit. Time, the first T here, it says on here 150 minutes a week. So that's 30 to 60 minutes each of those 4 to 6 days that you exercise. If you don't have time to do it all in once, if you're really busy and you can't get in an hour of exercise all in one time, it is okay to break it up and do, 20 minutes in the morning, 20 minutes in the evening, something like that. Or if it's just too hard to exercise and you're not used to it and you can't do a whole hour without killing yourself, then you can split it up if you need to. And it does have to be, well, let's finish this. So the last one here is type. So like it says on here, anything you enjoy. But make sure that includes something that's aerobic, that's going to keep your heart rate up, Also some strength training is really important. If you build up your muscle mass, you're going to raise your metabolism and also makes the aerobic stuff easier. And then also some stretching. So make sure you're stretching before and after you exercise. It's important to do both. Exercise does have to be regular to be effective. You have to do it all the time. My favorite thing to tell my patients is that exercise is like brushing your teeth. You don't really have to brush your teeth, right? But how long would you want to go without brushing your teeth? A day, a week, a month, a couple years? You're going to get a lot of benefits from brushing your teeth and a lot of bad things if you don't. So exercise is kind of like that. You have to do it all the time. You can't just say, okay, I'm going to exercise, do it really good for a week. Okay, I'm good. I don't have to do it for a while. It's not like that. You have to do it all the time. And stretching is like that too. If you really want to get the benefits, that we talked about from stretching, you have to do it all the time, consistently. Sorry, I'm talking really fast. Do you guys have any questions so far? Comments? No? Okay. All right. So then after you exercise, you should also stretch. But again, you don't just stretch, you have to cool down. So that means you lower the intensity of whatever exercise you're doing for the last 5 minutes. So if you're jogging, slow to a walk. If you're on the treadmill, slow your speed down, lower your incline. If you're on a bike, pedal a little slower. Just do whatever you're doing, just do it a little less to cool down for the last 5 minutes. And if you abruptly stop physical activity, you can cause heart arrhythmias. It also stops that lactic acid from coming out of your muscles as easily, and so you're going to be sore. And then it also causes some blood pooling, and it can make you get lightheaded. So it's really good to cool down. And then after you cool down, then you end with some more stretching. And you want to really focus on the muscles that you used during your activity, same as if you were warming up. And then also stretch your whole body. So stretch everything. And remember, moving stretches 8 to 12 reps and holding stretches 10 to 30 seconds, just the same way. Let's see. If you are consistently having pain when you're stretching or exercising, then you need to try to figure out what is causing it. So I want to talk about injuries for a little bit and what you can do about injuries. If you have severe pain, it usually definitely means that something is wrong, and you should stop doing that activity or those stretches until you figure out what it is. There's a couple of different kinds of injuries. If you are consistently exercising and stretching, then you are less likely to have injuries or problems. So different injuries depend on what you do with them. The first one is like a repetitive strain injury. And that one just means that you're doing something over and over again, and it causes something to have a problem. So they're usually chronic. It's usually because of your job and something that you have to do all the time. Those kinds of injuries are really good to stretch for and really important to stretch for. And if you strengthen and stretch those areas, then you're going to have less problems with them. Another kind of injury is a traumatic injury. So if you've had a fall or a blow or something sudden happen to you, that would be a traumatic injury. These kinds you don't really want to stretch. You don't want to do a lot. You do need to maintain your range of motion, but don't push it at all. You don't want the pain. And it has to be done really progressively. Usually traumatic injuries, you would need someone to help you, like a physical therapist, get better. The last kind of injury is called a prolonged static stress injury. And this happens when one injury or stressed part of the body causes another part of the body to be affected. For example, if you are a truck driver and you're sitting all the time, you could have some back problems like your discs or ligaments in your back. These kinds of problems are chronic and usually do have to have some kind of surgery to fix them, these kinds of things. So once you have figured out what caused your injury, then the first step is to figure out what you can do to stop causing more injury. So if it's a motion that you have to do all the time, see if there's something that you can do to alter what you're doing so that you're not doing that. Like maybe you can fix your posture, and that would help. So fix whatever you can. And then, let's see. So most injuries are going to be to your ligaments or your muscles, and those are sprains and strains. So I wanted to talk about those a little bit and what you can do about them if you have something like that. So for the first 3 days, the first 72 hours, you want to use an acronym, PRICE. Okay, I had this written down, but I don't know where it went. So think of the letters PRICE. So the letter P is for protect. You want to protect that area. Don't keep injuring it. R is for rest. So you want to rest it a little bit. Rest is really important, but you don't want to rest it too long because then you're going to lose muscle and you're going to have a hard time healing, okay? But for the first 3 days, that's okay. Ice is for eye, so you want to ice it, especially right at first. Don't put ice on your bare skin, but you want to ice it 10 to 20 minutes out of every hour for the first little bit, at least the first day. That's going to really help with pain and with swelling. The C is for compression, so like an ACE bandage or wrap to kind of keep everything in there. That's going to help with swelling too. And don't do it for too tight, and don't keep it on all the time. Give it some rest. And then the E is for elevation, so you want to elevate it, get it up above your heart, relax. Okay. And also for sprains and strains, unless it's really minor, you probably do want to see a doctor, even if it doesn't hurt super bad. All right, so then after those 3 days, usually some of the swelling has gone down. It may not hurt quite as bad. So then for the next 2 weeks, you want to focus on heat instead of ice. So moist heat. You can use those microwave packs that you can heat up, or a rice pack or something, or you can soak in warm water. And then you also want to work on massage. So massage the tissue around it as deep as you can without a lot of pain. It probably will hurt a little bit, but you don't want severe pain. You don't want to, if you're wincing, then it's too much. And then this is when you really want to start the stretching. But don't push it too hard. Really light and gentle stretching. You want to stretch 2 to 3 times a day. And then never do any activity that really hurts it. Like I said, your body is really good at knowing what is good for it and not good for it. And we don't believe that saying, no pain, no gain anymore. That's out the window. So after that, after the next couple of weeks of doing those things, then the next 2 to 5 weeks, you're really going to focus on getting your range of motion back, your flexibility, your balance, your muscle, all of those things. And usually you have to go through a certain set of stretches for that body part, and it's really good to go to a physical therapist to figure out what you need to do for that exact part. Let's see. And they also have some other stuff that you can use, like ultrasound and e-stim, that can really help your healing. So, all right. So we talked about stretching before exercise and after exercise, and also some stretching for injuries. The last thing I want to talk about is really just everyday stretching, or doing it every day just to stretch so that we can do all those things that we want to do and not be sore and feel good. You wake up in the morning and you probably stretch without even thinking about it, right? You kind of stretch your legs out and your arms a little bit. So maybe take it like one step further than that, get out of bed and focus on some more parts of your body. So when you're stretching every day, what I suggest is try to work on one muscle or body part at a time and work it through its full range of motion, all of its movements, what it would normally do. And then remember that moving stretches or dynamic stretches, those should be 8 to 12 reps. Static stretches or holding stretches should be 10 to 30 seconds. Make sure that you stop when you feel tired. Don't overstretch. And make sure that you're trying to get that maximum range of motion for every joint, and then stop. All right, I looked online, and there are tons of different stretching routines, things that you can do depending on what you're looking for. So there's everyday stretching. There's certain stretches for like pain, if you have chronic pain like in your back. There's stretches for fitness. There's some depending on how old you are, or if you're male or female. There's different ones for depending on what time of day you want to stretch. If you want to do it in the morning to help you wake up, or at night to help you get tired. There's different stretches for the activity that you want to do, like if you're dancing or basketball or just going for a walk. Those are all different. And then you can find certain stretches for just certain joints or muscles that you want to work on. You can find stretches to do like just in a chair while you're at work and want to do something. So I just have some basic ones up here if you're interested in any of these. And I thought that maybe we could go through some of them. So I won't make you get on the floor because there's lots of floor stretches, but if you guys want to stand up. Okay, so like I said, we're going to start with one body part and kind of go through all of its motions. And then remember to breathe. So breathe in as you're going into the stretch, breathe out as you're in the stretch, and then you can relax, okay? And so we want them to be 10 to 30 seconds. So let's just start with our neck. So just look one way and hold that for 10 seconds. Okay, and then look the other way. Remember, you want to feel some tension and some pressure, but not pain. So push it a little bit, but not too far. Okay, and then look up. And down. Okay, and then tip your head one way. And the other way. Good. Okay, and then let's bring your arms up. Okay, and then grab one elbow behind your head. And the other arm. Remember to keep breathing. Okay, and then in front like this. And the other arm. And bring your hands behind you. You're going to squeeze them together to do your chest. Okay, let your hands go, and then you're going to push up. Good. Now a waist twist. So you can either go to one side and hold it, or you can kind of go back and forth. This is one of those ones that you can do moving. Okay, now hang on to something. You're going to swing a leg forward and backwards. And switch legs. Okay, And then you can hold one leg up. Remember, if any of these hurt, don't do them. Sometimes this one's hard, especially if you have bad knees. Other leg. Okay, now a lunge. Front knee bent, back leg straight. Okay, switch legs. This is one where I tend to see people trying to bounce. Okay, then one leg in front of you, toe up. Your front leg mostly straight, back leg bent a little, and you're just gonna lean over till you feel it. You should feel that along the back of your leg. Sometimes it helps to put your foot up on something, a stool or a chair or something for this one.
Or the wall, like Marcus.
There you go, use the wall.
I had one.
Next leg.
Yep. I do what I can.
Okay, last one is just some calf raises. So up on your toes, up and down. Okay, that's it. Do you feel more relaxed? Yeah. It works, it really does. You do it every day and you feel better. Okay, do you guys have any questions? No? You guys want to take one of these so you can do some at home? It has lots of floor ones on it too. We won't do those today. I'll make you get on the floor. So, thanks for coming.
Thank you.